So today we're going to be looking at the gross motor function measure, which is used to determine the current level of function of children with cerebral palsy in regards to their gross motor function. It can also be used to show change over time with therapy. While it is specifically validated for children with cerebral palsy, it has also been shown to assess gross motor function in children with Down syndrome or with brain injuries. It's used for children from ages 5 months to 16 years old, although the motor skill age of those children should be either 5 years old or younger. It is scored by doing several different activities, each one scored 0 to 3, 0 being not initiating the movement at all, or 3 completing it with no difficulty, and each one of those activities is given a max of 3 tries to attempt. So we have 2 different forms of the gross motor function measure. The first one is the GMFM 88, which is the original one and has 88 different items scored. The advantage of this one would be that it's much more detailed and is better for lower level kids, so either very young, spending most of their time in supine or prone position, or a high level of disability in concerns to cerebral palsy. So that would be a level 5 on the gross motor function classification system, which is a system used essentially via observation to determine the severity of cerebral palsy. A disadvantage of the GMFM 88 would be that obviously this takes a very long time to complete. It is also used for children if they have to be wearing shoes or an orthoses, and also if they have to use a mobility aid. The other one would be the GMFM 66, which is an obvious advantage for that would be it's much shorter and easier to administer because it's less items. And it is also more validated for children with cerebral palsy because each item is weighted based on the difficulty. However, because each item is weighted differently, it's not validated for any other diagnoses like Down syndrome or brain injury because it's weighted specifically for children with cerebral palsy.
So touching on some clinical relevance here, the prognosis for gross motor function of children with CP is highly variable. So this kind of highlights the importance of this as an outcome measure tool for this population. So the GMFM is effective for measuring change in gross function, and accurate measurements of change in gross motor skill acquisition is important to develop effective intervention programs for children with CP. So the GMFM provides outcome scores that reflect how much of an activity the child can accomplish rather than the quality of the activity itself. The score provides an enhanced understanding of activity outcomes. This understanding can ultimately lead towards achieving contextual participation goals for said patient. Depending on the GMFM score, the therapist would be able to develop an appropriate plan of care to address the patient's specific activity limitations. And the GMFM can also be used as a primary outcome tool to justify frequency of treatment.
So to continue to highlight some of the clinical relevance of the GMFM, we have to go back to the Rosenbaum study that Reagan mentioned earlier. What the key finding in that study was that over a period of 5 years, Rosenbaum was able to track the progress of children with CP with this outcome measure. And what he found was that the prognosis was highly variable in these people. What he specifically found was that these patients can sometimes hit an area of plateau and then actually show periods of increase after that plateau. So this is important for in the field of physical therapy because this helps us then take this information to insurance payers and be able to say that while this certain patient may be plateauing in their score of this outcome measure, progress still can be made. And then we continue on with this by the works of Hannah et al., and they were able actually to take this information from the works of Rosenbaum, and they were able to turn it into percentiles for each level of the classification system for the GMFM. And what this is able to do, again, why this is helpful is now this kind of gives us a guideline, or rather some normative data of what we compare patients to. For example, if someone was in the level 1 classification, we can do the GMFM 66, get their score and plot it by their age and be able to find what percentile they're in to order to give us a rough idea of where they should be. And so here we have a list of all of the materials that you need to administer or set up this outcome measure. As you can see here, it's kind of a comprehensive list, but it's important to note that for the purposes of this presentation, we'll only be doing the first half of the study, so we won't quite be needing all of these materials. Another important caveat to remember with these materials is that The user manual for this outcome measure does specifically outline some of the dimensions for some of these items and can be found there. Another important caveat to remember about the administration for this outcome measure is that it is purely observational. And what the user manual defines as observational on this point is that it is a hands-free experience on the physical therapist point. The only thing we are really allowed to do as physical therapists is we are allowed to put our hands on to place them in the starting position, but then we should be just instructing the patient verbally to complete the different items on this outcome measure. There are other strategies that a physical therapist can use for our non-compliant patients as well. These include things such as follow the leader, role playing, and crawling through a tunnel.
Okay, so we have Aaron here, a 3-year-old, for our case scenario, and he does have CP. He was diagnosed at 18 months of age, and he's coming to physical therapy because his father has noticed just some delays in his gross motor development compared to some of his peers. So he is also classified as a level 1 according to the GMFCS.
Hey, how's it going, you guys? My name's Anthony. I'm going to be your therapist. And this is Aaron, right? Yeah. Hey, nice. And it's Dylan, correct?
Yep, that's right.
Hey,
Nice
it was
to
good to meet you guys. Meet you. So, like I said, I'm going to be your therapist today. From what I've read, you're a little worried about some of the stuff that's been going on with Aaron because of his cerebral palsy.
Yep, that's right.
Okay. So what we're going to do today is we're going to do like 50 things together. We're going to have you laying down and rolling and sitting. It's going to be a lot of fun. But with each of those things that I have him do, try your best. If you can't do it, that's totally fine. Just let me know, okay?
Okay.
All right, the first thing, just go ahead and lay down.
All right.
On your back. And Dad, you can have a seat over here.
Awesome.
Okay, so the first section of the GMFM is going to cover 3 different positions. And so with the lying and rolling, we have supine, prone, and prone on forearms. In supine, the clinician will look for the patient to turn the head with symmetrical extremities, so keeping their extremities by their side. Also to see if they can bring their hands to midline, touching one with the other. Also if they can lift their head 45 degrees. As well as individually flex each hip and knee through a full range. As well as reaching across their midline of their body with their arm like so, to like grab like a toy, and rolling from supine to prone over each side. In prone, the clinician will test to see how the patient performs with lifting their head upright, rolling to supine over each side, left and right, and pivoting to the right and to the left 90 degrees using their extremities, their arms or their legs. And then with the patient prone on their forearms, the clinician is going to test to see how the patient lifts their head upright while extending their elbows like so, and then basically seeing how they can lift up their chest. Also, we want to see how well does the patient weight shift onto one arm when extending the opposite arm forward.
All right, so the first thing that we're looking for, go ahead and just look right up at the ceiling and hold your head there. Very still, great. First two things we're looking for are him being able to hold his head just like that and then being able to bring his arms to midline, so that's perfect. Next, I want you to try and look towards Dad.
Yeah.
Hey, Dad. Great. All right, so the next one is, if I was you and I was doing this, try and bring your knee up to your chest. Very good. And the other one, and down. Great. Those look good. Okay. So the next thing I want you to do is, Dad, do you want to come over here and grab that toy? Okay. So come up towards his shoulders, Dad. Awesome. So reach over with this arm and then grab that toy from your dad. Great. All right, can I have it? I'll give it right back to you. Thanks. Okay, reach over here and grab it. Very good. That's good. Okay. Now, what I want you to do, can I have that back one more time? Thank you so much. Okay, go ahead and roll towards your dad. Very good. Okay, now come back and roll towards me. On your back, all the way. Great. Very good. So now what I want you to do is come up on your elbows. Great. Yeah, very good. How's that? Is that pretty easy?
Yeah.
Good. You're looking great. So now what I'm going to have you do, Dad, I'm going to give you this toy back. And still on your elbows, I want you to try and reach and grab that toy from your dad, okay? So good. And pass to me, pass the ball. Now go ahead and still on your elbows, reach and grab it. Very good, that's great. Okay. So now the last couple things I want to see you do is go ahead and from your elbows, I want to see you roll over to your dad. Like a ninja. That was really good. And then I want you to try and roll back towards me and stop right here. Okay, very good. Now, last thing for this one is try and pivot. Try and on your hands and knees still. Try and go over and face your dad. Very good. Now come back to me. Great, you can stop right there. That was really good. Those didn't seem too hard for you.
Yeah, it was fun.
Great. Well, mind if I talk to your dad about how that went?
Can I play with the toy?
You can definitely play with the toy. So for this first one, just looking at how he does lying and rolling, he did really good. Yeah, he got 3s on everything, and when we get to a point where we're worried about a score, I'll talk through this for you, but right now, he's doing great.
Oh, awesome.
Yeah, so now I'll move into sitting.
Okay, so the next section that we have is in sitting. So what we have is, as you can see, is a lot of different positions that come in the seated position. So what we'll start off with is from supine to sit. So really, what we want to test is to see how well does the child maintain head control when pulling up using the examiner's hands from supine to sit. As well as we're going to test the patient rolling to either side and then sitting up as well. Then from there, we're going to do sitting on a mat timed. And so basically each of these motions will have a specific time. And these motions are, sitting with the head facing up, then, maintaining midline while being supported, as well as sitting with and without propping their arms, sitting on each side. So that's like on their left side or on the right side. And then sitting on a bench timed without their arms. And again, all of these have a very specific time component. Then we want to have them sit on a mat with a toy. And so this basically this basically has the child going in and out of their base support without propping and basically touching a toy either side, basically at a 45-degree angle. Then we have them sitting on a mat untimed. And so what we want to see is basically just transitioning them from prone to sitting, and then transitioning from sitting with their feet in front of them to then going into quadruped, and then going right and left, and then pivoting 90 degrees without the use of their arms. And then lastly, we have them sitting on a bench, and that is without arm or feet support for 10 seconds. Then sitting from a standing position, so we're going from standing to sitting, and then from the floor to a small bench, and then the same thing going from the floor to a larger bench.
All right, so now we're to the next part. We're gonna be, we're starting out laying down. We're gonna get to sitting. It's gonna be fun. I'm so glad you're excited about it. All right, the first thing that I wanna see you do, I'm gonna bring my arm up and grab it. Grab the other arm too. All right, I want you to pull yourself up. Very good. Very good. All right, so what we're seeing there is if you're able to sit up and control your head. That was great. So the next ones are kind of hard, but go ahead and face that way. So look that way. Good. So I want you to go from lying down, then I want you to roll, and then sit. And first I want you to go towards your dad, and then you'll go towards me. That's it. That was great. Okay, come back, lay down again, and then do it towards me. Very good. Hey, that was great. High five. Nice. Cool. All right, so this next one that I want to do, if it's all right with you, I'm going to put my hands on your chest and keep you upright while we look at your head and neck.
Okay.
Is that okay?
That's fine.
Okay. All right. Go ahead and sit up nice and straight. Good. 1, 2, 3, and then we're going for 10 seconds. 2, 4, Mississippi 5, Mississippi 6, Mississippi 7, Mississippi 8, Mississippi 9, Mississippi, and 10. Very good. Okay, go ahead and relax. So now what I want you to do, you can use your arms, but I want you to sit up nice and as tall as you can for 5 seconds. Ready? 1, 2, 3, 4, and 5. Very good. So now without your arms, try to stay up nice and straight, but for just 3 seconds this time, okay? 1 Mississippi, 2 Mississippi, and 3 Mississippi. Very good. Okay, I'm gonna put this in front of you, and I want you to reach forward and grab it, and then pull it back. Reach, 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 reach. Very good. That was really good. So now I'm gonna put it behind you. It's gonna be a little bit harder to get. Okay, reach back and grab it. Reach, 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 reach. That's great. Okay, back here. Reach, 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 reach. Very good. Okay, so the next thing I want you to do, mind if I borrow that toy? Thank you very much. Have you named this toy yet? Do you have a name for it?
Jeffrey.
I like the Jeffrey. We're gonna keep Jeffrey over here. So the next thing I'm gonna have you do is to go back on your stomach again, but I want you to do it nice and slow and careful, okay? So we're going back on the stomach. Nice, that was good. So the next thing I'm gonna have you do is go ahead and sit up just like this, as we were doing earlier. Good. So now what I want you to do is go over towards your dad, and we're gonna try and go on hands or knees, okay? Very good. Okay, come sit down here again, and then come towards me, and on hands and hands. Okay, very good. Yeah, you're really good at those.
Thanks.
Yeah. So now what I want you to do is to turn so that you're facing me, okay? Try not to use your arms. Like a floppy pro. All right. Okay, so for this next one, what I want you to do is if sounds fun to you, we're gonna sit on this bench. I'm gonna have you try and not use your arms or your legs to keep yourself balanced, okay?
Okay.
Ready? Yeah, go ahead and take a seat. Good. 1, 2, 3, 4, 5, 6. Oh, I got you. That was a good try. All right, go ahead and let's sit down again.
6 is still pretty good.
6 is a great number. Jeffrey was really happy with you getting a 6.
Same as chainsaw now.
Oh. Okay. All right. So the next one is we're going to use this small bench, okay? So I'm going to go over here for you. So come and stand up with me. Good. All right. Now let's sit on this small bench. Very good. Okay. Now go ahead and let's get back on the mat. Alright, now you come back and sit on this small bench. I know, we're doing a couple things.
It was just here.
I know, you were just here. Great, and then now I want you to come back on the mat. We're getting your workout for today, bud. And then try and stand up over here and sit on the smaller bench. I know we're moving around a lot. You're doing great. Very good. Alright, now it's hard for you to keep, so I'll help you get off. Okay, and then go ahead and sit down, and I'll talk to your dad. So there you go. So he's doing pretty good. It looks like you've been working on him at home with some things. That's really good. So he got a 3 on almost everything except for sitting on the bench was a little bit hard for him. And so 0 would be like, I marked him a 2. A 0 would be like, hey, I really can't do this at all. A 1 is, I tried it, but I really can't do the activity. A 2 is, it's partially completed, so he's able to do it for like 6 seconds.
Sure, versus the 10 that we were looking for. Okay.
Which would have been a 3. Yeah. So don't worry, 1, 2 isn't a really bad thing.
Okay.
So all right, we'll keep going on to the next portion.
Awesome.
Okay, let's do it.
Okay, so the last section that we have for our part of the GMFM is crawling and kneeling. So just to clarify, and we had a little confusion with this, just to clarify, crawling in this case is actually on hands and knees, and then creeping should be understood as just on their belly. So it's a little bit opposite of what we learned, but that is how it is defined in the GMFM. So going on with that, we have the 4 point. We have lots of different positions there, and really the clinician is just going to test how well the patient performs those several tasks in quadruped, including maintaining that position for 10 seconds, transitioning to sitting without the use of their arms, reaching forward about shoulder level with each arm, forward crawling or hitching, and they use 1.8 meters, which is 6 feet. And then we also have forward reciprocal crawling, as well as crawling up 4 steps, and then lastly crawling backward 4 steps. Then we have in the prone position, we have the clinician is going to examine the patient. How well can they attain the quadruped position if the patient can, and also if the patient can creep forward again 1.8 meters. Then the patient will start in seated on a mat, and the clinician is going to examine how well does the patient attain high kneeling, also synonymous with tall kneeling, so on both knees, with the use of their arms, and how well the patient can maintain tall kneeling or high kneeling for 10 seconds without arm support. And then lastly, with the patient already in high kneeling, the clinician is going to test them to see how well can they transition from tall kneeling to half kneeling with the use of their arms, and then how long can they maintain that half kneeling position without the use of their arms. They can do it for 10 seconds. And then again, lastly, I think we have is if they can really kneel, so on their knees, can they walk 10 steps on their knees? So that was a little bit unique, but that's the last portion of the high kneeling section.
All right, so you did really good. When you're trying to sit and you're just trying to sit without using your hands and your feet, I want to give you a couple more tries of that one. Do you want to try it a couple more times?
Okay.
Okay, go ahead and sit down on this chair. Great. And then we're going for 10 seconds. Ready? 1, 2, 3, 4, 5. Oh, we almost got there.
That was scary. I
That
thought
was
it was
good?
fall.
I gotcha.
Yeah.
All right, do you want to try one more time?
Yeah, one more. I got it.
All right, let's do
this.
it. Ready? 1, 2, 3, 4. Oh, 4. That's all right. All right. Well, I think we're gonna keep the score for that one, but every time we get one where it's not a 3, we're gonna try it a couple times just to make sure.
Okay.
Cool. All right. Go ahead and let's get back down here. Well, what we're gonna do is we're gonna get just like this, and we're gonna army crawl over to that side of the mat. Okay. Crawl, crawl, crawl. Crawl, 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 crawl. So good. All right, you're good. All right, let's sit up again. That was really good. So the next thing that we're gonna do is we're gonna go on our hands and knees just like this, okay? Good. And we're gonna stay here for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Very good. All right, so stay there. Now what I want you to do is to go back to sitting. All right, very good. Go ahead and lay on your stomach again. Scoot forward just a little bit. Great. So now what I want you to do is we're gonna go back up to our hands and knees from here, okay? Okay. Okay, let's do it. Let's do it. Great. So now, with this arm, try and reach for your dad. Okay, and high, up, reach up, high, 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 high. Very good. Okay, put the arm back down, and then let's do it with your left. Up, 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 and very good. Okay. All right. So scoot back a little bit for me. Okay, we're gonna start right here, and what we're gonna do is we're gonna crawl together to your dad. So good. Let's go ahead and stop. That was great.
Good job.
Yeah. Good. All right. So now this next one, we're gonna be using these steps. Ready?
Okay.
Okay. So what we're gonna do is we're gonna start right here, and I want you to try to, using your hands and your knees, crawl up these stairs, and then once we get to the top, we're gonna go back down, okay?
Okay.
Very good. All right, now when you're ready, let's come on back down. Come on down. It's a tough one, huh?
Yeah. I don't know.
Okay.
I
That's
don't.
all right.
I don't think they can.
Try once more. Okay. That's all right, bud. What I want you to do is go from where you're sitting to do what I'm doing right now, okay? Getting on both your knees. Good, up, 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 up. Good, we're gonna try and stay here for 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, and 1. Very good. Okay. The next one, we're gonna go from here. We're gonna bring this right knee up, okay?
Okay.
Good. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. Go ahead and go back down. Okay. And then now we're gonna do this leg up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. Go ahead and start. You did a good job. Okay, and then the very last one that we're gonna do is we're gonna be like this, and let's try and walk over to that table, just like this.
I can't.
You can?
I can't.
Are you sure, bud?
Yeah, I can't.
Okay, you wanna try one more just like this? We're marching forward.
No,
Is it scary or hard?
I can't.
Can?
I can't.
Okay.
No, I can't.
Okay. All right. That's all right. All right. Well, we're done with those. So that was great. It was really good. You talk to your dad about it.
Okay.
Okay. So he did really well on a lot of things. The ones that he had difficulty with was going backwards down the steps, obviously.
Mhm.
So he started it, but he wasn't really able to do much.
Yeah.
And so we're gonna give him a 1 there,
Sure.
which is tough. And those stairs kind of hurt a little bit. So that's fair.
He has some trouble with stairs at home, so
Okay.
that makes sense.
All right, and then just a 0 on the last one, trying to step forward on his knees. So whether that was scary or hard, I'm not really sure.
Sure.
But we can work on that together.
Sure.
So,
Well, that sounds great. Well, thanks a lot.
yeah, no problem. All right, let's move on to the next one.